Hello, everyone, and welcome to another edition of the Scenic View podcast. If you are hearing the sound of my voice, you survived New Year's and you're ready to tackle 2026. So let's get to it. All right. As I did not mention before, my name is Jonathan Owens. I'm the communications director here at SEANC, alongside Artis Watkins, executive director, Suzanne Beasley, government relations director, and Sammy Klein, our podcast producer. And we have a special guest, the specialist of guests, SEANC president, the esteemed Wendell Powell, joining us on this first episode of the new year to talk about what's going to happen in 2026 and what we're looking forward to and what we're excited about. So how are you guys doing?
I'm glad to be here. I mean, being here in 2026, we survived the new year. So, hey, we're ready to get busy.
Let's get down to it. How about you folks?
Oh, we're always excited. I know, Wendell, you worked your hiney off ending 2025. So
it was a very busy end of 2025. Meetings, a lot of holiday get-togethers and showing my face and getting out across the state and still doing work in the prison. So it was a lot to get done. So, but I'm happy that things have calmed down.
Yeah, we always talk about on our social media every holiday. We throw a shout out to the folks who have to work on holidays. And you actually yourself had to work this year, right?
Yep, Christmas Eve and Christmas Day.
Both.
I always shout out people, say, hey, make sure your state employees that are working, save them a plate or bring them a plate.
There you go.
That's right.
Remind everybody what you do, Wendell.
I'm a correctional captain at Harnett Correctional. So, like I said, I run shift and, we make sure that everyone's where they're supposed to be.
Yeah.
If you're part of the North Carolina political world and you have happened upon this podcast, this is a great example right here in the room with us. State employees, you don't really think about them. You would think about them if they weren't there, but you don't think about them. They went without a raise this year.
Mm-hmm.
They got their premiums increased on their health care.
Mm-hmm.
And everybody thinks all of this is okay. But remember, when you're home on Christmas Eve, wrapping last-minute presents, enjoying some eggnog, there are many, many people like Wendell, not just in the prison system, but all over state government who have to work. And that's not true of most of the private sector. So just remember, this is part of what it looks like. You're essential, and yet you're not treated as essential when it comes down to paying you and giving you your promised benefits.
And you'll actually be surprised how many state agencies are actually working during the holidays. Ensuring the roads are clear, all this inclement weather, making sure certain services are being done. The troopers are out. We're still doing what we do in prisons. We're like a little city. We're 24/7. We don't
HHS facilities.
DHHS.
I mean, all of that doesn't stop just because the holidays happen.
Hospitals. So there's a lot of agencies that just.
And we have the conversation regularly too that public perception of state employees is not widely understood or widely appreciated, clearly.
And it would be nice if one day, we can get groups to just walk a day in the state employees' shoes, just to see the day in, the day out, start to finish. This is how I start my day. This is what happens during the day. This is how I interact with the public. What's important, what's not so important, what are our things that we must get done? Because we're all mandated to do certain things that you might think is menial, but we're mandated to make sure these things happen like clockwork. So things you take for granted, you think, oh, well, it's supposed to be that way. But there's people who are trying to make sure that happens. Your services aren't interrupted.
Can't just shut down the prison, send people home, right?
Oh, no.
and y'all are doing all of this in a staffing crisis.
Yes.
Yeah. Not to be flippant, but I'll bring some levity to the discussion. Are the inmates any nicer on Christmas Day?
Actually, during the holidays, they're actually more chill during the holidays than they are any other times. Most of them, they're focused on their families.
Mm-hmm.
They've heard from their families. They get their Christmas meals. We have different churches, organizations that come through and do things for the offenders. So, they're more laid back. You don't really have as many issues during the holidays.
Had a little extra joy.
Yeah.
Yeah.
Well, that's nice to know.
Most of them are festive.
Yeah. Like I said on this episode, we do want to kind of look ahead at 2026. since you'll be listening to this on the second day of the year. And we've already got a little bit of foreshadowing of what's to come this year. 2 items out of the state treasurer, Brad Briner's office, about what's to come in 2026. Possible premium increases yet again, and he is not supporting a COLA for this year. So those are 2. I just want to maybe jump out and we'll talk about that first.
I think there's going to be a lot of people upset because I already have staff reaching out to me about what's going on with our premiums. Healthcare is the biggest thing right now, and these premiums. And to hear that you're going to increase the premiums on top of what's already increased for
and no pay raise.
And we haven't even had a budget or a pay raise yet. So everybody's holding their purses.
Let me ask you this, Wendell, since you're here. You supervise people in a lot of different pay grades. The way the treasurer's office had the board do the increases for premiums this year in the health plan was dependent on wage. So the lower you made, the lower your increase was. Their idea was that would only be fair, that people who could afford it, quote, should pay more. Although I do want to say the CEO of a healthcare system making $25 million a year, we're not asking him and his system to afford anything else. But hey, I digress. So what are you hearing from folks? Are they like, yeah, okay, I like it better because it's...
Well, from what I'm hearing, I mean, this is coming from wardens. You're talking about people, who are higher level in the state. They're all complaining because they're like me. They're supporting the family. I have the high option family. So I'm paying the high option.
Yeah.
So I'm paying more than an officer would or a sergeant, people in those pay grades. So it's a lot just to support your family, and that's monthly.
Yeah.
Coming out. So you take a big hit, and then you're talking about everything's going up, the prices of food, gas. So you have to factor all that in, and that's a nice chunk out of your day-to-day living, and trying to foreshadow for the year the kids' needs. How's this year going to look? So
well, and I think, John said possible health plan premium increases in 2026. What the stated intention sounded like, the treasurer did a call with the media where they could ask questions this past week. And he was kind of sounding, Suzanne, like it was very likely that what the treasurer's office will ask the board to do is increase those again. And I think he said by at least $20 a month.
And unrealistic for us not to expect that.
Oh, yeah. And you already have state employees who are complaining about issues going to the doctor and the health care, and their co-pays are up. So now you're adding more fees, more money coming out their pocket. It shouldn't cost you $100 to go see a doctor when you're sick. We understand the co-pays. We understand specialties, or something like that. But just to hey, I need to see my doctor, I got to pay $100 to $200 just to see a doctor. It's not feasible to be out of work. Especially if your job says, hey, I need a note because you're out for a couple of days, and now you're spending money. You're getting it from both
it's
directions.
A lot. And again, I say no pay raise.
Yeah, it's unfair.
So it's interesting, though, a lot of the way this has been put out there, and it has been, this is because Dale Folwell didn't increase premiums on state employees for 7 years. Thomas Friedman, the executive administrator of the plan, was quoted in a story by Rose Hoban last week saying, I keep saying today, y'all, because here's the deal. We record this ahead of time to go out January 2nd. But Rose Hoban wrote a story for, I think it's North Carolina Health News. She was at our board meeting of the Board of Trustees of the health plan. And she said, yep, they talked about the financial issues with the plan. And she quoted Thomas Friedman, and I'm paraphrasing here, as saying, if we'd been raising premiums every year on state employees this whole time, we wouldn't be in this fix. Well, there's nothing to say that's true. We love Thomas. We've had him on this program a number of times. But let me tell you why there's nothing to say that's true. We have no evidence, no proof of what we pay, healthcare systems. We talked about on one of these podcasts recently, one of the CEOs of those systems makes $25 million a year. But we can't see what we're paying them with our state money that's meant for this employee benefit. So they're overcharging us is the almost 100% likelihood here. And by multiple times what they should be charging us. So to say if the employees had paid more premium, we would be okay. Sounds like a bunch of hooey to me, because what would have happened is those guys would have just kept overcharging more.
Mm-hmm.
And you really know that when you look at North Carolina being the number one costliest place for healthcare in the country, period. Not even just looking at state employees and retirees.
Yeah.
So Dale Folwell, did he cause that too?
Yeah.
Did Dale Folwell not increasing our premiums make North Carolina the most expensive place for absolutely everybody, even if they work in the private sector? It's silly. It is absolutely silly to say we just haven't been taking enough out of the wallets of our state employees to make this system work. But hey, don't make us show you what we're paying for your health care. So the other thing about Rose's article that was interesting to me, she went to this health plan meeting, listened to the whole thing, and did her research elsewhere to write this article. And I didn't see anything about what has been very public, the $25 million salary, other huge healthcare executive raises. That can only happen if your profit is way out of whack. Not a word to that in the article. So it is just a given out there right now to let it go and not talk about that piece and only talk about, yes, state employees don't pay as much premium as we think they should, or as much as some people think everyone in the private sector does, which is also not true. Because I have friends who work for some companies who provide amazing healthcare, and even their dependent coverage is very, very low because it's a benefit to be competitive. So it's not true that everywhere else that people pay huge amounts for their health care, but it's also overlooking the fact that state employees take less salary, supposedly for better benefits. But it's not better benefits now. It's not.
No, it has eroded over the time. And I think, like you said, artists, they need to look at the profitability and versus what the actual state employees are contributing. Because if you're making wide profit margins, that means you're making money.
Nobody will show that. So it's easy just to say you should have been paying more all along. But we're going to fight back on that. But I said I wasn't going to rant and rave because this is the new year and we're going to rant and rave plenty of the year. And you're going to be our partner in that if you're a state employee, retiree, or a friend or loved one of a state employee or retiree. Hopefully you will listen to this podcast and know when it's time to rant and rave. But what we need to do is keep framing the issues for what 2026 is going to bring.
And Samuel looks a little perplexed over here. What were you thinking? I saw it, the wheels turning in your head during that.
My thought process is, okay, so they're saying Del Falwell should have raised premiums. That wouldn't have made state employees any happier.
No, it would have more.
If you just kept doing it every year.
Well, no. They don't think it would have made state employees happier. The point is,
well,
they
why
don't
are we
care.
playing the blame game?
Because it's
either way,
easier,
no one's happy.
Because it protects the massive powers that be, the powers that be that pay $25 million salaries to one person. It protects them.
I believe former Treasurer Falwell called that the cartel.
He called it the cartel. And what his issue was when Dale Falwell was treasurer is I'm not going to stick it to the working people, to the police officers, to the teachers, to folks working in prisons, to folks working in HHS institutions. I'm not going to stick it to them when I can't say what we're paying to these massive corporations running these hospitals.
Yeah.
So to say something like that, wouldn't you think that Reiner and Friedman have kind of an idea of what they think premiums should be, and are they working up to a level? And it's because if you said that Falwell should have raised premiums for 8 years, what if he did that like $20 every 8 years? We'd be up to $160 a month. You know?
I'll tell you how we should look at this. When the school vouchers, when that bill was passed, private schools cost what they cost. And what happened to private schools the next year after we said you can have some money to send your children to private schools? The state will pay for part of that.
Exactly. The
tuition went up. So you could increase the premiums on state employees, and I promise you now, the price that we're paying for healthcare will go up yet again. And that affects every single person in the market, not just state employees.
Yeah, the providers are going to take what they can. I mean, it's just free market economy, right? I mean, it's like capitalism. You get as much profit as you can.
It's becoming a monopoly that kind of flies in the face of capitalism.
Really, because people can't not have health care.
Right, and then you'll hear, we got to take care of these healthcare systems because otherwise we won't have rural healthcare. Who's been buying up and often closing facilities that provided healthcare in rural areas? These healthcare mega corporations. If that solved the problem, we're overpaying now. If overpaying was solving the problem and providing plentiful healthcare in our rural areas, we'd have that now, and we don't.
We wouldn't be the bottom of the list.
Yeah.
I grew up in a rural area. My primary care doctor was bought by UNC once I went to college. My mom, her company just sold their practice to a large facility, even though they were a small private-owned practice, and catered to the people in that area.
And I was talking to someone probably like a month ago. We were just talking about history, and I remember when certain areas, like in Greenville, their hospital was small.
Yeah.
Or certain areas, you had these little outfits, and now, they were like urgent cares, and now they're like huge complexes. I mean, you see these, and it's everywhere. They're just, I mean, they're huge. Like, so they're getting money. They're building new facilities. So there's money in the healthcare. So you can't say there's no money or you're struggling when you're buying. You're creating,
buying and building.
Yeah, use spreads
with grand pianos in the lobby, right?
Back to what you said, Wendell, about state employees' benefits eroding. Interestingly, I had a conversation with someone last night who has been offered a job with the state and declined it because of the provision in 21 when they stopped giving health insurance at retirement.
Yeah.
It's like, yeah, that's a big deal. But this person would not refuse to take the job because that was the point in coming to work for the state. They knew they weren't going to make a ton of money.
That was the original promise. The original promise was, hey, we're not going to pay you a lot, but your health care package and your benefits, their health care was supposed to be better than the private sector.
Right.
And
retirement. Now, when you look at the overall, it's way worse. It's not beneficial. No one wants to come to the state because they're like, I can work at Burger King and make more.
Exactly.
I was just out west last month, and basically the prison couldn't even compete with the fast food.
Yeah.
In the job
we've
fairs,
heard that.
because Burger King, Subway, Sonic, they were making more than correctional staff
with benefits,
100%.
with benefits in the area. So state employees can't, and some of the job fairs they couldn't even go to because this prison wasn't paying enough. I thought that blew my mind. I said, how can the state agency not pay enough that you can't go to a job fair?
Right.
Yeah.
But that was just incredibly telling to have that conversation last night.
We've got a huge problem. So in 2026, one of the issues that will be hopping, and I mean hopping, is going to be healthcare because the legislature needs to weigh in at this point. The problem we had where Dale Falwell had said, I'm not going to put it on the backs of these average working state employees, is because he was told he could not make public this information about public money that was being spent on this health care. And he wanted to make that public. He wanted to be super transparent. And he was met with resistance at that time from the folks who were in the legislature at that time. Now, that's not this current legislature, so it's not anybody's fault right now. But the people who are there right now in 2026 have some work to do. They can either decide they continue to sweep all that under the rug and, keep this stuff hidden and make it fine and legal to keep it hidden, or they do something about it. That's where we are.
Just feels like even nationally, the leaders don't want to pay for health care or subsidize health care because they say it costs too much, right? It's too much of a burden.
It does cost too much.
But why does it cost too much?
Well, we're having a whole debate over whether to subsidize.
Yeah.
When the debate should be, why in the heck does it cost what it costs?
Yeah.
And that's what no one wants to discuss, John. That's my whole thing. My problem with this is that if you won't put the numbers out there and it's public money, we're in an era in North Carolina politics of transparency.
Except where we don't want it.
Except where we don't want to look.
Yeah.
And that's where the big money power people are, and nobody wants to look at them. But for the average person listening to this right now, they don't give a poop if somebody makes $25 million to run a healthcare system. They care if they can put food on the table for their family.
Yeah.
This is
just
wrong.
a slight tangent. We regulate energy costs,
Mhm.
electricity costs, right?
Mhm.
Why do we not regulate healthcare costs? It's just as important.
I think you can.
It's too
But
much
you know
money
what?
in it.
You don't even have to go that far. Just make them say what you're paying them.
Yeah.
That'll be embarrassing enough.
Just tell people what you're paying them. It will be embarrassing enough.
yeah.
That's all we need
Because
to do.
you see
This
those
is
stories
easy.
all the time.
We're not looking for more regulation, to be clear. We're not looking for more government interference. In fact, we're looking for government to stop interfering by stop hiding things. That's all we're asking for. Just put it out there.
They don't want to show the money. You have to show. They have to show their hand.
So what this says for us in the year 2026, this doesn't have to happen to you as a citizen. It doesn't have to happen to you as a state employee or retiree. We have ways to fight back. Listen to this podcast. If you're not a member of SEANC, join SEANC. We will be more active than ever on the issue of healthcare. And I know the other issue you just mentioned, John, that is equally important is cost of living adjustments for our retirees.
Mm-hmm.
Yeah. So in a story from December 17th on the CarolinaPublicPress.org, State Treasurer Briner opposes COLA for state retirees, which is not a great headline for a
Not a great
state
headline at all.
employee, and I mean for the state retirees to hear.
Yeah, retirees are going to be very much in an uproar. They're already done their service to the state. And, you got to think about that. You work for the state 30 plus years back when some of the salaries were lower than they are now. So how are they getting along?
Yeah.
So it makes a big impact. And it doesn't entice people to become state employees because they're looking at, okay, long range for your retirement. If you're not even trying to give them COLAs or have the adjustments for their living expenses, then what was the point?
Yeah, we've got a chart actually that, it's the history of COLAs, a nice table we made. 2017 was the last time that a true COLA was given to retirees. It was 1%. And then there's a bunch of zeros in that column of the table where there have been no COLAs. Now, part of that time was during a period where we didn't have money, so you can't have a COLA.
Meaning gains, profit off of our
Yes,
investments.
the
in
investment. So we can't have a COLA because we're not making the money in the system. You guys have heard me say it before. The system is built to produce its own COLA from gains from investments. So that's been the problem. Not enough money, can't have a COLA. Here we are. Was it $14 billion? I believe the number was just a few weeks ago in investment gains that have been experienced in the retirement system, and we still can't have a COLA.
So, the basic gist of the story was that the state retirement system has gained about 6.5 or 7%, which is about $16 billion, which we talked about a few weeks ago. And then they asked Briner, well, that's great. Can the retirees get a COLA now? And he turned to the unfunded liability and the debt and said there's still a lot of work to do on that. And then you, Suzanne, were actually quoted in the story. Thanks for doing this interview.
Sure.
You said everybody's not going to retire at the same time. So while it's important that we get back under control, the sky is also not falling.
That's right.
Good job.
They need a COLA. There's money. The Treasurer's Department has reported that money. It's big money. When do we get a COLA?
And you also got the word "but" into a story. Did you know that? You said Treasurer Briner is obviously kicking butt with his investment strategy.
All right.
What we would like to see is that money used in a way that directly affects the pocketbooks of retirees.
Yes.
Yeah. Our retirees are struggling.
Why do we care if you make 50% in returns? If people are going to turn around and say, no, we've got this other thing we need it for, which, by the way, when Dale Folwell was focused so intently on the unfunded liability, no one cared.
Yeah.
So this is another case of where, look, the goalposts are moving.
Yeah.
For state employees and retirees. They're just moving. If we make money, oh no, we got to fund the unfunded liability. If we don't make money and we say the unfunded liability matters, well, you can't have anything because of all that either.
Briner thinks that 2027 could be a more appropriate time for the legislature to
It's
approve
always
a COLA.
the next year, right?
The next year.
It's always the next year. Always has been.
We'll go to Disney World next year, kids. Y'all just be good.
I gladly pay you Tuesday for a hamburger today.
Yeah.
That's a bad concept to run the state on.
Yeah. And retirees are lost 30% of their buying power.
Guess what? 2027, the electric company won't want their money. They want it right now.
That's
what retirees are facing. So
So, yeah, Suzanne and I worked a little bit on this chart together this week that she was mentioning. And I thought it was interesting just looking at the numbers. Retirees have lost buying power every year since 2001. And in 2011, they actually went below zero. So they actually started having negative. And so now they're 30.7% below the cost of living if it had kept up with inflation.
Right. And as we talked recently with the Secretary of the Department of Military and Veterans Affairs, we were talking about how we want North Carolina to be a place retired military would want to come because they're such a big part of your economy. Retirees spend money. Yep. Same is true of state employees, and we talked about that on this podcast recently. If you're not increasing what the retirees are bringing home, that's money literally not going into your local economies.
Yeah.
You're hurting your economy.
So that means that
no tax revenue.
Sometimes you can spend $1 and you don't get it back, but that dollar you give to a retiree, the state's going to get back.
Yeah.
They're not going to Cabo.
Nope.
So that means that retirees' check from 2011 bought 30% more than it does now. I like to do that.
No, that's a good way, good breakdown. Yeah.
Different ways to think about that. So in 1999, retirees, the raise was 12% more than the cost of living adjustment. So those were the good days, huh? Okay, that's enough math talk for me. But I did like doing this table, and it's on our website, too. You can go check it out.
And then there's the other piece. If you're doing an equation, a math equation, you have to have all the variables. And the variable we still don't have on retirement is the same one we don't have on healthcare. What do the contracts with the investment managers investing this money, what do they say? We don't know. It's public money. It's not just public money. It's public money, and then it's 6% of every employee's paycheck every month.
Yeah.
So some of it's your money. Double your money as a taxpayer, but also 6% of your paycheck has to go into this system. But then you can't see where it's being what the terms are of how it's invested.
Yeah,
that's what would irritate me. I'd be sitting there like, give me my money back then.
This probably. I'm sorry. I'm not calling you old, artist, but
it is what it is.
This predates you, but maybe you have.
Good Lord, it is old.
Maybe you have some insight. Like, why were the COLAs so much more in the 80s and 90s than they are now?
So the system was funded fairly consistently.
Okay.
And it was also invested under Treasurer Harlan Boyles for years and years in a really conservative way, kind of the way Briner's talking about wanting to conserve now. Harlan Boyles was pretty much a 65-35 split investment-wise, and I think Treasurer Briner's talking about something like a 70-30 split in around 2001.
Yeah, that's pretty much the change section.
You can tell I'm old. In 2001. No, that was the year Governor Easley escrowed some retirement funds, which SEANC had to sue, and it took years and went all the way to the Supreme Court to get that money properly put in the system, get that money back. But in addition to that, that was the year the state took a complete holiday, didn't put anything in towards their employees' retirement. Now think about it. If you did that in your personal investment, you'd throw yourself back deeply if you weren't putting anything in for a year. Well, the next year, I think it was less than 0.25%, and we inched up from there. Now you're seeing the legislature put in big amounts, but it's out of desperation and necessity.
Mm-hmm. Yeah.
Again, how much desperation and necessity, we're not sure because we can't see the contracts. So we don't know what we're paying people to invest this money. You could be paying people any number of hidden fees. And the reason we say this is not just to be conspiracy theorist, but because there is proof of other public pension systems doing this. And what tends to happen is most people have very similar contracts all over the country.
Guess what the teaser's total increase in 1989 was?
Do tell.
6.7%. That's the highest on the list.
Yeah. But remember, when you retire in North Carolina, you start out well behind what you would in any other state in terms of how your retirement check will be calculated.
Yeah, that year did include a formula increase, which is what you're talking about.
Yeah.
The starting formula.
So for 2026,
But-
The gauntlet's been thrown down that you're not going to see the treasurer's office apparently fight for a COLA. If you don't have the treasurer's office fighting for a COLA, it is beyond impossible to get one out of the legislature, except
it's an election.
It's an election year. And retirees, you need to get vocal.
Yeah. And that brings us to our next topic, which it's an election year. And I guess all of these things tie into that.
Well, I would say before you even get to that one, pay would be the
Oh, yeah.
next
Yeah.
Hey, yeah, let's talk about that. I mean, obviously they have to do something about I guess they don't have to do a budget, right? But you would think they would, right?
Well, I mean,
You thought they would this year?
yeah.
I'll shut up.
You can think anything you want to.
You don't
Doesn't
have
mean
to.
it's gonna. Yeah, they don't have to. And we were told at the end of June, I think it was. Maybe it was in August. Anyway, when they took their break, was told by someone in leadership actually that they would not be talking about a budget until they came back for short session, and it does appear that that's the way it's going to play out.
Any idea what we're talking about percentage-wise or anything? No.
Oh, my guess is if they throw anything out there, they'll throw 2%
2%'s
out. Yep.
the standard.
The standard election year 2%, if anything.
Yeah.
And then that's going to, state employees are going to have fit. Now, I don't know, they'll propose probably a one-time something for retirees, which after taxes of that won't change their lives.
Yeah.
But all of these things, the thought will be this might be just enough for people not to be super angry.
It is.
And I'm thinking this is what's going to come out of both the governor's office, which is a Democratic governor, and then the Republican-run legislature. I don't think anybody's going to come out of the box saying, yep, give those state employees 8%. I might be proven wrong, and I sure hope I am. I hope that they all hear people like Wendell talking about what they face and the dire situation they're in staffing-wise, and realize that as important as teacher raises are, that there's other public employees out there just as important doing tremendously vital work, and they're going to quit those jobs if you don't do so.
So that means SEANC members and state employees, you need to be prepared. You need to be knowledgeable about your voting practices and who you're voting for. You need to understand, what districts you represent. You need to understand, what your health care actually looks like and what you're signed up for or what are options. Right now we have Lantern going on. They're starting up January. They started January 1st. So if you have procedures, they are offering free options. Please take advantage of anything that's out there that'll help you as a state employee to, get further ahead, because as you can see that you're not getting any help from our leadership.
So I have a question for y'all. There's a chance this could be a close election or closer than in years past at the legislature. Does that multiply our effectiveness as a nonpartisan or bipartisan group? Like, are we a big pool of voters that are attainable for both sides, enough so that they will listen to our concerns?
Well, our success rate is pretty high when it comes to races.
You're asking about in terms of raw numbers or what could. So there are certain legislative districts in which state employees and retirees are not as significant a presence, but there are more districts than not in which if you had state employee, their spouse, or retiree and their spouse, any adult kids they have, or people, neighbors and friends that love them and listen to them, voting for the person those folks say treats state employees and retirees well, it is enough people to make a difference in a vast number, because you got to remember, it's going to be low turnout. It's a midterm election. Yeah. It's going to be low turnout. And so any group, whether it's state employees or any other group, if they can marshal their forces together and get them all educated and out to the polls for whoever it is that is throwing down for them, they can move the needle.
So the areas like that, I guess, would be like Raleigh.
It's actually, it depends. Yes,
Burke
obviously
County.
You think Wake, Burke, Granville, Wayne. Those come to mind immediately as huge concentrations, but that's not where it's limited to, because you have to remember, so many retirees have gone and relocated from wherever they worked. So there are a number of communities where it's more than you think, and especially in terms of people who turn out and vote. What we have noticed with SEANC members is they're not just registered to vote in huge numbers.
They actually vote.
They do vote,
Yeah.
Yes.
They vote. And that's a gift that we have.
So I guess our challenge as an organization is to educate those folks and get them all on the same page and voting as a block, right?
Always the challenge. And also to get involved. And we're going to have the Impact Chair, Junior Hewlin, on here soon to talk about that, because getting involved is where a group like SEANC that's so big can make the difference by boots on the ground, making phone calls, talking to everybody you can find, being really active in elections.
I was listening to a podcast on the way here, Chuck Todd's podcast, and we're going to talk about podcasts in a second, but he was saying, nationally, even, like $100 donors don't matter at all. $10,000 donors don't even matter that much anymore. It's like the huge numbers that really matter. But groups like us have an advantage that we've already discussed this on the podcast, that, our strength is our numbers.
Our people,
I mean, you see commercials, every other commercial at election time for somebody. It's the net effect at this point is just noise. All the money you spend on signs, there's always the age-old debate, do signs work? No matter where you come down on that, that's a ton of money. All these things are a ton of money, but nobody can really show the huge impact of that compared to who are voters most influenced by. It's not any piece of election advertisement you come up with. It's somebody they know, trust, and respect telling them about a candidate and believing in that candidate.
And we hate to say this, but, there's a lot of state employees who aren't SEANC members. So talk about this to your coworkers and get them to join first off.
You have to get active, If you know SEANC members.
At least educate them on our...
go to a meeting, find out where the local meetings are in your areas, and go and become informed, because at our meetings, we do give out information, what's going on in the area, what's going on across the state, what are going on in these state races, how to get involved in impact and to affect, your family, because who you choose affects how your family's taken care of and the future of our state.
Yeah.
So like I was saying about the podcast we were discussing before we went on air here, it's important that you know who you're getting information from too. And I think that we could, suggest a few good places other than the Scenic View podcast, which should be first on your dial. That should be your go-to. But if you want to learn more about elections and healthcare,
politics in
general, news in general,
keep up with the issues,
make sure you're listening to and getting news from reputable sources. And that doesn't mean like one side or the other. That just means someone who's telling you real information, not something with an agenda. I guess here in North Carolina, we have some good political podcasts.
Journalists,
journalists. I like Colin Campbell's WNC podcast, State Politics. The Under the Dome, Raleigh News and Observer podcast is always kind of a staple for everyone.
And Tim Boyum.
Yeah, Tim Boyum's Spectrum News podcast. What's it called?
Tying It
Together. That's right. I'm sorry, Tim. I listen to it every week. But yeah, just make sure you're listening to, just don't listen to some crazy person talking about God knows what. Make sure that the information you get is right.
Well, if you want to maximize your ability to contact your elected representatives and be knowledgeable on the issues and feel confident doing that, again, we would suggest first join SEANC, because we will get you all that information. We communicate all of that with our members all the time. But in addition to that, if you have time, you like to listen to podcasts, maybe you'd like to try them out. Those are some good ones, because that's just journalists talking about the issues. And when you call, you'll be amazed how much more confident you feel talking to elected officials.
Yeah. I always think it's funny when someone, spouts off that you have an agenda, you're scenic, you have a...
We sure do.
We sure do. Like, that's the thing that I always want to say.
Employees and
everyone has an agenda.
Yeah. But the thing I always want to chime back with is like, yes, our sole goal is to protect and enhance the benefits and rights of state employees and
our retirees. Yeah.
So if you're one of those groups, you should listen to us, because that's all we're trying to do. That's...
Well, and I maintain that you don't have to be a state employee or a retiree to care about what we're saying, because you're paying taxes to get public services.
Yeah.
So, we talked about it again a few weeks ago. If your taxes are cut, but your services are cut so deeply that you're thinking, this state doesn't seem like the state I used to live in. It's we're not getting much. It's getting kind of wonky.
Yeah.
Well, you have to follow what happens with public employees because that's who's providing the services your taxes go towards. No matter what your tax rate is, it's to provide services. Those are provided by people, and those are the people we're representing.
And I'm going to tell you something. Let these services start dwindling and
it's already
taking a
happening.
hit. Then North Carolina's going to quickly not be one of those states people want to come and live.
Right. It's already DMV was the big uproar
Yep.
because everybody knew that state employees. But Wendell, y'all are so understaffed, and it's affected y'all in terms of staff and inmates getting hurt. It's affected y'all in all kinds of ways. But let somebody escape from the prison due to the understaffing and then hurt somebody. And let's see, you're going to see hell raised from beneath the earth's surface.
Yep.
But nobody can act surprised when that happens.
Took 6 weeks to find that kid in Craven County.
Yeah. But I'm telling you, if that were to happen, it would be outrageous for any politician to act surprised.
Yeah. I think that's their biggest fear of something actually big happening. I mean, there's been a lot of things that's happened, but it doesn't make the news. There's a lot of things that happen inside and outside of institutions and state agencies that don't make the news, but they're things that would be concerns to the public if they understood the magnitude of if it went wrong, how that would affect their families.
Well, we had a thing recently about infant formula. And, the Department of Agriculture has scientists who make sure everything's cool with certain products that are sold, that they don't have bad things in them, and that they have what they say they have on the label. And we had an issue about infant formula that people from DHHS and Department of Agriculture would have been part of the protection for us so that our infants don't get formula that has something harmful to them in it. And that was an eye-opener. But those kind of things, unless it's happening to you, you don't really know about it.
And it's just even the DMV issue, going back to that, all of a sudden it's like a huge uproar about how long wait times are and all that, but no one ever mentioned that they haven't been funded properly.
We haven't. We didn't increase the number of people serving the public, despite the public increasing by, I think, 20% during that period of time.
So they're serving 20% more people.
With the same number of...
Again, to act shocked and outraged is funny to me.
You're facing like a war of attrition. You can add more kiosks, but you still don't have the people to service the kiosks or manage. So it's like you're really not helping. I mean, it sounds great, and it's a good technological advancement, but who's running it? You still need the people to run it and maintain it.
And again, that's a bipartisan issue too, because we've had DMV just languished under both parties. And so this is all people have got to speak up because politicians, period. I don't care who your legislator is, what party they affiliate with, what consonant is next to their name on the ballot. It's going to be the same old until the public demands more.
Yeah.
Well, before we go, I just want to talk a little bit to Wendell here about what he has planned for this year for SEANC. I think that's important.
Put me on the spot. Well, for the 2026 year, like I said, the biggest thing is getting people informed, making sure information gets out about what's going on with our healthcare, getting our retirees organized and understanding what they're facing and how we can help better get their situation supplemented and find avenues to get them active within the organization and just get active in our communities because people need to hear their voice.
Yeah.
Our people need to have their voices heard, and we need, like I said, we need to understand what we're facing. There's an economic downturn. Things that cost more, services are going up. So we need to be smarter as state employees and as consumers on how we can better take care of our families and make sure that we're still performing at a high rate for our state agencies to make the state better. Because at the end of the day, we care about the state. We want the state to prosper, and we want to prosper with it.
Yeah.
But we also want to make sure we're taking care of our homes and we're handling our affairs accordingly.
And one exciting thing that I know of to help with the informing our members is we are launching a new website in January, February, Q1. We'll say Q1 2026. It's going to be awesome. And you guys are in for a treat.
Super excited for that.
I'm pretty excited about it as well.
And that website is at
SEANC.org, at www.seanc.org. I've noticed whenever you spell out scenic, this is a tangent, on your email address, J-O-N's at S-E-A-N-C, it always sounds like S-C-A-N-C. Mm-hmm. So I've missed a lot of emails that way. So I always pronunciate the E. But I digress. So I think we'll leave it there. It's been a long episode. Maybe we'll just not have a question this week, and we'll see you next week.